Hi, my name is Claudia Rivera-Salas. I'm a nurse practitioner at Pine Hollow Partners in East Lansing, Michigan, and today we're going to talk about Deucravacitinib. So when I think about Deucravacitinib, what really stands out is how simple it is to use in practice because it's an oral once daily medication with a fixed dose, no titration, no routine dose adjustments needed, and the patient can take it with or without food, which makes adherence a lot easier. It also has very minimal drug-to-drug interactions, so you don't have to constantly rethink their med list. Mechanically, it's a selective TYK2 inhibitor, which sits on the broader JAK family, but it does work a little bit differently because it targets a regulatory domain instead of the active site of the kinase. So that selectivity is important because unlike traditional JAK inhibitors, Deucravacitinib actually doesn't carry black box warnings for things like serious infections, malignancy, MACE, or VTE. And in clinical trials, we haven't seen a signal for increased risk of those events, which aligns with its more targeted mechanism. Another practical benefit is that routine lab monitoring isn't required. However, it's not recommended for patients with severe hepatic impairment. Clinically, I do tend to check labs for all of my patients on my biologics once in a while, but at least we know that routine lab monitoring isn't required. Right now, Deucravacitinib is approved for moderate to severe plaque psoriasis and psoriatic arthritis in adults, and it's being studied for a lot of other immune-related diseases. As for pregnancy and lactation, the data is still limited. There's no data on the presence of Deucravacitinib in human milk, but it was found to be present in rat milk, so I typically avoid recommending use or proceeding cautiously. Overall, it's an amazing option if you're looking for something effective, but easy to manage from both a provider and a patient perspective. Thank you for listening. For more information, please visit the Contact Room or RAP ACE app.